I am being dispatched to scene of a shooting. The scene is safe. Policemen secured the scene. My PPPs are on. Nature of injury, shooting, possible trauma may be involved. Call ALS backup. ALS backup. 2nd Street, 789 address. Yes. I do see, and it is a bystander. I'm going to ask some questions as to what happened. So excuse me, sir, can you tell me what happened? What happened? Man, I was just coming up my yard, and next, I see my dog across the street, and I was like, what's up, Joe? What's up? You hear back and turn my head. I see this black car just pull up on the scene and just pop, 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 and just drove and shoot my man. And my man just dropped on the porch. I was like, dang, that's my dog right there. So I picked up the phone. I decided to call 911. I said, that's my dog. Hope he's going to be okay, because that could have been me, You know what I'm saying? It's my man can be okay. Man can be okay. So, man, help my dude. He bleeding, man. The dude just 16. Okay, sir, thank you. My general impression, I do see a young teenager with gunshot wounds and bleeding from chest area. Very unresponsive. Sir, can you hear me? Patient's unresponsive. I do have pulse. I'm going to go ahead and secure patient head, neck, C-spine collar, measure from chin to patient's shoulder. C-spine is secured. Sir, can you hear me? Patient still unresponsive. Patient is breathing. I'm going to secure patient airway using jaw thrust. Open up jaw thrust. Okay. Patient airway is patent, free, and clear of any secretion or sweating. No bleeding in patient's mouth. Patient's breathing. Agonal breathing. Oh, 911 backup is on its way. Patient respiration rate. Patient is breathing at a rate of 4 breaths per minute. Agonal breathing. Oh, signs of cardiac arrest. Patient is bleeding from chest area. No gag reflex. Measure OPA from earlobe to side of patient's mouth. Patients accept. Going to begin bagging patient. 15 liters of oxygen, high flow, at a rate of 10 to 12 breaths per minute. Ventilating patient. I'm going to ask my partner to take over ventilation. As to take over ventilation, I'm going to secure and control bleeding. On the patient's shirt. The left side, there's bleeding. I'm going to clean the area, the sterile gauze. Clean the warm area. Patient's still not responding. Apply firm pressure over the area. Going to put a sterile gauze over it. This point. Secure. Area, apply compression, place an occlusive dressing over the area, compress it and secure it, and tape in all 4 corners. Area secured. Area secured. All 4 corners. Okay. We're going to go ahead and load patient onto ambulance with backboard and do a secondary assessment within transport with light and siren. Patient is placed on backboard secured. Patient is placed, continue being ventilated, placed in the ambulance. Okay. Going to bystander. Shooting happened over 10 minutes ago. Patient is not responding to any pain or cannot describe the pain. Secondary assessment. Head to toe. No trauma or bleeding to head. Patient's eyes. Non-responding to light. 2 milliliters dilation. Patient's ears, no bleeding, no sign of trauma on the brain. Nose, no bleeding from the nose or trauma. Patient's neck, I do see tracheal deviation to the right side, which is affecting patient's airway. May explain as to why patients have agonal breathing and a respiration rate of 4 breaths per minute. Patient's chest, further assessment that the shooting took place. There's a gunshot wound about 1 centimeter below patient's left nipple on the left side. Chest area. Assess patient abdomen, no distension, no bleeding. Patient's pelvis, no crepitus or joints muscles. Upper extremity, lower extremity, no crepitus. In upper extremity, in joints or muscles, nor in the lower extremities. Can you squeeze? I do feel a pulse in the upper extremity. Do feel a pulse in the patient's lower extremity. Sir, patient's not responding. Be able to squeeze my hand. Okay. Patient's vitals. Blood pressure, 60 over pulse. Patient's heart rate. '52, Brady. Respiration. No 4 quadrants in patient's back. Agonal breathing. Absence on the left side. Patient's back. Patient's glucose level. Glucose reading, 80 milligrams DL. Patient still unconscious. GCS score of 3. This patient continue to be transported. I'm going to reassess patient in the next 5 minutes. The vitals. On reassessment, patient's airways now patent. Breathing. Patient is breathing at a rate of 12 breaths per minute. Patient's skin is normal. Patient's blood pressure. (100/60) within normal range. Patient's blood pressure is normalized. As my partner continue to ventilate patient. Heart rate 60 beats per minute. The normal range. Patient is showing signs of stabilization. The glucose 80 within normal range. So, patients withdrew from pain. Patient's GCS score now is 4. I'm still not responding to speech or verbal, but withdrew from pain. Patient is being bagged with an oxygen rate at 99%. My field impression: patient is experiencing shock and cardiac arrest. While my patients continue to be monitored and bagged and rapid transport to the nearest home care center at San Juan. I'm going to go ahead and radio my report. Unit 1, Med 1 Unit 1823 ready to report. Med 1 Unit 1823 responding to call for shooting incident for 16-year-old black male. Upon arrival upon the scene, a young teenager, 16 years of age, weighing about 130 pounds, laying unresponsive, with bleeding to the chest, agonal breathing, tracheal deviation to the right side. There was a 1 centimeter gunshot wound to the left side of patient's chest. Patient was experiencing cardiac arrest. C-collar spine, was placed on patient to prevent further injuries. OPA and patient airway was maintained. Patient accepted OPA. Patient was being bagged BVM, 15 liters of oxygen at a rate of 10 to 12 breaths per minute. Bleeding was controlled. Patient was kept warm in a blanket for signs of shock. Patient's currently now GCS scores is 6. Patient respiration rate 12 breaths per minute. Patients continue to be with BVM. Patient blood pressure stabilized 100/60. Patient heart rate stabilized 60 beats per minute. Are there any more questions? Are there any questions or any others at this time? Then we will see you at 18:45 hours. Thank you.